Don't just watch TV. Make it. Enroll now. Spaces are limited. Visit our website on www.dominion.org.ng or call the number 0706 777 9435 0706 777 9435. Dominion Television, your channel of choice. Live from the heart of the action. Welcome to the nerve center of Next Level Broadcasting.
This is the OB van, where the studio meets the street.
Equipped with cutting-edge cameras, crystal clear audio, real-time switching, and broadcast control, we don't just capture moments, we deliver the experience live.
Anywhere, anytime, from stadiums to red carpets, breaking news to buzzing festivals, weddings, birthdays, and all sorts of ceremonies. We bring the world to your screen in real time.
It's not just a van, it's a complete mobile production house, a command center, a broadcast beast.
This is more than a broadcast. This is the OB van difference. Live, loud, limitless.
Ready to go live? Like never before. Book the OB van today and take your event to the world. One powerful broadcast at a time.
To book, call 0705 506 1061 or 0916 101 1061. Email marketing@dominion.org.ng or visit our socials on Instagram @Dominion Broadcast.
Dominion Broadcast, your channel of choice.
All right, welcome back from that break. Before we went on that break, I was telling you about primary health care as a foundation of any effective healthcare system. We have in the studio this morning the Executive Secretary of the Oyo State Primary Healthcare Board, Dr. Muideen Olatunji. Good morning. It's good to have you in the studio.
Good morning. Nice seeing you again.
Thank you. Let's start with the basics because of our time. When people say primary healthcare board, could you just give us an overview, of the primary healthcare system in Oyo State?
Thank you so much. I think you've actually answered the question in your intro.
Yeah.
You said the foundational.
Yeah.
And the healthcare service in the country is structured into 3 different levels. We have the primary, the secondary, and then the tertiary. The primary is the foundational healthcare service delivery. And the way and manner the healthcare in the country is structured, we run our healthcare system in Nigeria on what we refer to as the World Health System. And the world is the smallest unit of division of geolocation in the country. Now, coalition of wards constitutes a local government. Yeah. And the coalitions of local government form the states, and the state constitutes to become the country. So, in the structure of the primary care, is meant to be located within a ward and to be taking care of the health needs of people within 5-kilometer radius to the location of that primary healthcare facility, and is meant to render basic primary healthcare services. Vis-a-vis, you have the issues that have to do with something referred to as the component of primary healthcare service delivery: water, sanitation, and hygiene, maternal and child health, essential drug supply, treatment of minor injuries and ailments, nutritional services, counseling, immunization, we call it vaccination, and then dental health, mental health, school health are different components of primary care, and then non-communicable diseases as well. So those are diseases components you are to be able to handle. But majorly, what you want to do is to promote preventive healthcare service delivery.
In the grassroots.
In the grassroots. And now I talk about all those components. All those components I mentioned, they have embedded within them preventive measures that actually prevent the disease before occurring. It's so expensive to treat a disease condition, but it's so cheap to prevent it from occurring, because when it occurs, you have to activate so many processes before you can actually manage that disease condition, people that are involved, and the area that is so affected. So primary care is meant to deal with such. So it is the closest healthcare service to the people in the grassroots. And people have this wrong notion. When you say the closest people in the grassroots, they think about the poor of the poor. And this is a misnomer. This studio now, where we are now within the Yagoko, a health facility takes care of the health needs of people here. So if you are a governor, if you are a CEO, if you are a banker, when you have health needs, you should be able to walk to that primary care facility and be able to access care. So it means all of us live within the community. Now, the primary health care facility takes care of our health needs is until the PHC cannot really handle the health condition. They cannot initiate something to call a two-way referral system. They can refer you to either a secondary care or a tertiary care. Most of the time, it should be to a functional secondary health care facility. If your issue can be dealt with at that level, you normally supposed to be referred back to the primary care for the continuum of your health management. So this is just simple, brief overview of primary healthcare service delivery system in the country.
Okay, so you've been in that system for years now, and then you've wriggled through the stormy waters, as it were. Now, what has been the achievement of the primary health care in your state over the years, especially in recent times?
Well, it has been tremendous and a quick milestone achievement as far back as even 60s or 70s. In the primary care service delivery in the state, from the western region, let's close the western region, let's come to the state creation level where we started having states. Before, to oversee the primary care service delivery in Oyo State, we had only one medical officer of health. That is a medically qualified person to oversee the health needs of the three local governments. He moves around all the states.
Wow. At
the point in time, he got about 2. Later on, he went back to 1.
Overwhelming.
In the year 2000, during the era of Lamade Shino, under the leadership of the then Commissioner for Health, Dr. Bola Adetunji, made an argument before the executive that there's a need to have one medical officer of health in each of the local governments. So, in 2000, Oyo State recruited 33 medical officers of health. I mean, one per local government to oversee the health needs. This is a positive stride to make things change a little bit from where it was. And since then, there have been some. That's why people like us came in, even start joining the primary care service delivery. But you will see consistently over the years, there have been so much issues of neglect on the primary care service. We always say it's within the purview of the local government. And the funding that is usually put at that care
for that purpose
is not something commensurate to the needs that is so required. So we've been like that. There'll be challenges of funding, there'll be challenges of human resource for health, there'll be challenges of infrastructural decadence, there'll be challenges of the input, the logistic equipment that needs to be in the system. In 2004, we started a movement. Luckily, I was part of the HAFON, Health Reform Foundation of Nigeria, to start making a move that we all marked the word that foundational health system in the country is a primary care. Where we know local government alone cannot show that responsibility. Can we now have a need that everybody realizes that's the foundation? Must you want to build a house on a weak foundation? If you don't want your house on a weak foundation, because that can collapse on you, then make sure you have a strengthened foundation. That led to the move to enact for the first time a national health law there will be a first promulgation of legislation in the federal level that will really address the issue of health needs. And with that, in 2014, eventually, it was signed into law, which we call the First National Health Act, signed into law by President Jonathan. And by that law, it is now mandated for every state of the federation to establish something referred to as the primary care board. With that design, everybody has now agreed in the whole country that every level of every tier of government must contribute to the funding of primary care vis-a-vis the local government, the state government, and the federal government. So the federal government made a promulgation that a minimum of 1% of the federal accrued revenue will be pushed to the doorstep of primary health care service in the country. And every state now started the rat race to make sure they establish a primary care board in each of the states. Our state established primary care board in 2015. Yes. And since then, we started having some degree of improvement. In the recent time now, we did a gap analysis. What are the issues? Where are we? Where are we supposed to be? Then what are the gaps? Yeah. So we call it the minimum service package document, which we presented to this current government in 2019 when it came on board, and we analyzed some of the problems. So it became a Bible with the roadmap to which we can reinvigorate primary care service delivery in our state. And to be honest with you, for the first time, we're having very strong political will to support primary health care service delivery in the state. And it has been trophy from trophy since then that we've been having. First thing we identified was the fact that most of our health facilities are in a serious state of disrepair. I remember I told you the health structure in the country is structured on something referred to as the World Health System. Yes. So by that understanding, the governor said, okay, can we now have at least one functional primary health care facility in each of the political wards? Yeah. And our state has 351 political wards. That means we had this ambitious project to have at least one functional primary health care in each ward of the political ward. That means you have to renovate, upgrade, make sure it's expanded. Or if there's none, you construct. Yeah. And that's the stride we started. As at the last count, we've been able to complete 210. In the last few months, another number had joined that one. So now we are closing in around 300 that we're actually working on. Now in the next few weeks or months, it will be completed. More than 300 will have been completed. Less than 50 will need to be added to the load to make it 351, which has been a very major achievement that the state had achieved now. Now, after the renovation, while that was going on, quickly the government said, okay, let's start testing water. Now, in keeping there, because the gap analysis that was done was all encompassing what is actually required. Again, 264 of those facilities were equipped with the necessary equipment to make them work. Now, you have equipped, you have built. Now, is it going to be working by robots? No.
Humans.
We need humans. And you all know, even in the country, this JAPA syndrome, everybody living in the country, one of the major hit sector is the health sector. So we don't have enough personnel in the system. So we did table before the governor again. This is a gap analysis. Oh, he approved. At least let's start from somewhere. 30% of our need as human resource was approved that we should be able to recruit. And if you follow the news in the recent time, just the primary care board started the recruitment process.
Last month?
Even not last month. We started in 2021, which we placed at adverts. We could not, because of bureaucracy, we could not complete the process until 2024. When we did the exam, screening, and then started putting them into the system. As at last 2 months you talked about now, we have completed the process of engaging 3,903 health workers across all cadres. Okay. And since the time of establishment of your state, this is the first time somebody is taking such a huge investment in the health sector.
That's audacious.
It's too audacious, I must confess to you.
I hope it's sustainable.
By the grace of God, we are this system, we are running it. Okay. And to be honest with you, I myself, I became terrified at the point in time. There's somebody to be recruiting because one of the highest paid in the system are the health workers.
Yes.
And a governor is now recruiting
3,000,
almost 4,000.
Yeah.
At the time, the highest any recruitment in this state has been was about 300 personnel.
Because I wanted to ask you, when you said you had a medical doctor to one local government, and we had 33. I wanted to ask you the state of the number right now.
We now have 2 per local government now.
2 per local government.
Yes.
That's impressive.
Yeah, and if you have 2 per local government, it's structured in a way that the system is to make them run, and be able to design the day they will have to run clinics in some states. Even in some northern states, maybe you don't have. If you have 20 local government, you'll be lucky to have 5 or 10. Now, in the state, each local government can boast of 2 medical doctors already in the system. So that's the way. And then not only doctors we recruited nurses, community health extension workers, community health worker, senior CHU, pharmacists, dental technician. For the first time, we are introducing dental health into the primary care service delivery now.
Very necessary.
Now, so that dental hygiene can be improved upon. At least 2 dental technician or health worker will be attached to each of the local, and the required logistic equipment to work with is now in the process of being provided for them, so that people can actually access dental health services in those local government. If need be, they can now be referred to the secondary healthcare facility, then can be referred back for the continuum of service.
Do you have any relationship with environmental health officers?
Where
Once popularly known as Wole Wole.
Yes, very technical question. And if I must tell you, on that in this country, we tend to have policy somersaults. By the design of primary health care service delivery, the environmental health officers are a major component of the PHC. You know, when I was mentioning to you, component of primary care, the first thing I mentioned was water, environmental sanitation and water hygiene.
Yes.
And the officers are supposed to discharge this at the environmental health. So they are supposed to be part of the primary care service delivery system in the whole country. But unfortunately, some time ago in the year, to stand on, so it's a cocktail of professionals. You have environmental engineer,
you have foresters,
everybody to play a role there. But they are unipolent officers that are supposed to play a major role in PHC service delivery. For instance, issues of abatement notice, house regulations come under the purview of the Medical Officer of Health. You can go and read through the public health law of the Federation of the state. That's well established there. That officer cannot exercise that function very well, effectively well, without environmental health officers working in tandem with him. The challenge within the system, I mentioned to you the establishment or the promotion of the National Health Act.
Yes.
That law made provision for the establishment of primary health care board in each of the state of the federation. At the same time, it made provision for the establishment of the Social State Health Insurance Agency in each state of the federation. Then there's a fund we call the Basic Health Care Provision Fund. The minimum will be charged through different paths where we adjust and be able to move on.
You've talked about policy for your state government.
See each of the milestones, what do we do and what do we achieve. Again, something which Novel that the state has done is funding of the PHC services in the country. In the state. Because, like I told you, one of the major problems is the issue of funding. Enough funds are not there to keep things running. One money I said, how do we get those funds now? What we do is that statutorily every month, 7.5%. You know, I mentioned to you that PHC is under the major purview of local governments.
Yes.
State and the federal only come into support. So apart from the budget provision that we have at the state level to run the system, again, consistently every month, we design a way, is in the law now, that 7.5% of the allocation due to each of the local government comes to local government as a basket fund to run the system. And this is novel.
I don't want to ruffle feathers.
Yes.
But right now, I need to ask this question.
Yeah.
If you're saying 7.5 of local government allocation goes to primary healthcare centers, or the primary healthcare, the centers in each local government, does it come directly from the local government, or does it come from the state? Because there's been this. There's no issue with Oyo State. Yeah.
It comes from each local government. It's a remittance from each of the local government to run the system.
Statutory remittance.
Yes.
Okay.
It's not that just go and dip into it. No. Fund goes to local government.
Okay.
Each local government, in their monthly allocation, remit to the central fund. State government remit as well. Okay. I just got the letter now that we are going to get additional remittance of 2 quarters from the federal government now to the same pause. Do you understand?
Yeah.
That is the way it works. Now, other states now are even coming to copy
What
the
is
model
obtainable
because
here.
it is making the system to run on auto drive.
So apparently the issue of local government autonomy, when it comes to that aspect, is put to bed.
It's put, there's no cause for alarm. It doesn't cause any. So because it was not done by fiat. It was not done by say, oh, let me just dip my hand to no. It doesn't work that way.
It's a process.
There's a process, and the law has been well taken care of. So it becomes seamlessly. So come rain, come sun, the system runs.
The Oyo State residents with these primary health care services.
Well, the channel of engagement, when we came and to design it, like I told you, we work based on the fact that we have on the ground and working through the needs of the rules of active ward development committees in each of the wards.
Okay.
Now, this fund, I told you that we push at the Edge facility. The chairman of the ward development committee is a signatory to the accounts.
Okay.
The officer in charge of the facility is a signatory to the accounts.
Okay.
So any decision that will be taken in that facility involves the ward development committee members.
So there's inclusiveness.
Yes, they must hold ward development committee meeting in which the officer in charge of the facility, our own staff, is a secretary. It doesn't disturb the development committee from having their own any regular committee meeting for
just feedback.
Anything on health,
Report.
it becomes the secretary. So they get the feedback, they design what they want to do. And there are many committees like that are even taking very giant stride in pushing for health. So the involvement of the WDC committee member is well strengthened in our state. I can tell, and regularly they hold their meetings. Then the chairman for the whole state, come to me, Alhaji Oloyede, come to interface with me from time to time. In many of our programs, we engage them so that they can have an insight into what we did. Last week, we had a task force meeting on PHC, and member of the community, as well by WDC, Alhaji Oloyede, was in attendance. The Yaloja Amerigo was in attendance. Khan,
Christian Association of Nigeria.
yes, was represented. Ditto for the Muslim community and Form 1, the chief imam had representatives there. So you will see that everything that we want to do, we involve the community. That's the concept of PHC. It should be community driven, and it must be accepted to the member of the community. Those are the way we make it work, and that's why we're having so much success that we're having.
So let's look further now. Let's look ahead. What are those key areas you think Oyo State government should look into to improve primary health care in Oyo State? Yeah,
well, I will only say that the core of our innovativeness is half full, not half empty. Okay. So definitely we can really add onto it. Okay. And there's nothing perfect in this life. We just continue improving as you move on. Like I mentioned, we have been able to increase recruitment into the system now, but it doesn't mean that's all we need. We might still need more to come into the fold now. The emergency services is just been reinvigorated now, whereby we're having a body now to oversee the emergency health service in the state, and we're going to interconnect with the community and other private players as well. The PH services is going to be a major player, insurance is going to be a major player. Some general hospital within that area will become a major incorporated player. So what we tend to do now, we're trying to go digital now to integrate most of our function and activities. Online. So that online, and we're moving from paper record to e-records now, the e-health. We are working with so many partners now to see where can they come in to help us to take it further, to be in tandem with the current reality. And it will involve a lot of capacity building for our personnel. Government might need to give us more funds to build the capacity of this personnel, get so many gadgets to make the system work, and be able to improve from where we are now. In the state, we have well over 700 facilities, which are under the purview of primary care. And we focus attention on 351 for now. That doesn't mean that's all we need to do. We can still go.
There could still be an improvement.
Yes, and but the government has started very well. And that government is audacious in the way about it went about things. Challenge, it now becomes a challenge for the person coming tomorrow to keep that pace and consolidate on the
Yeah.
success strides that we've been able to build a solid foundation now and challenge everybody. Come and see the way it can be done. We've done it for 5-6 years. Okay, let's see if you can do and maintain it. If somebody has done something for 6, 7, 8 years now, and you should know that it's sustainable, and it now become a challenge for everybody coming tomorrow to see how to make it better and run the system. And we must be able to get people that actually understand the system, the running, to make it run efficiently very well. So the state will do a lot by integrating all healthcare, all level of healthcare services, primary, secondary, and tertiary. We need to collaborate and integrate. We can fuse together and work like a simple machine. We don't want people benefit more from it. And then funding for healthcare service can never be too much enough now. We still need more funding.
Of course.
And we need a lot of motivation to keep
Oliver
people,
Twist is always asking
exactly,
for
to
more.
keep people staying
Yeah.
in the system. Remuneration is of importance, germane importance. How do we take care of the welfare of the healthcare workers to ensure that they are motivated to stay in the system? And there will be a challenge to the government that they need to do. And when they are doing that one, security is of paramount importance, and in which you need to work around and make sure that every person is secure. So by and large, these are one of the windows we are looking through, and we're sure we can surely get there to the land of Canaan.
All right, before we leave, in just 1 minute or less, your candid advice to policymakers and stakeholders in the health industry.
Thank you. Well, to the stakeholder policymakers, when you talk about policymakers, all of us are policymakers when we get to a particular level in life. But when policies are made, we should have the strong political will to walk through it. In this country, we've had enough laws, we have enough policy formulations, but our bane is the courage to walk through those policies, to implement them the way and manner they are designed. So I think it's for all of us, not only those at the executive level again. Can we all try to be audacious? Then we should be free, that we should be lucky to have a willing and a listening political power. If all the policies we have in our state now, all the idea, innovation, where if the governor is not in tandem, is not tuned to that, not going to be done. So we're lucky because the governor is in tune with everything that we said to him now, because they want to deal with the reality. So it's a two-way thing. They need to play their role. Can we challenge them and push them to do what they're supposed to do? Can we be sincere with what we're supposed to do?
Dr. Funmi says, you'll be fine, Mama. Dr. Funmi says, you'll be fine, Mama. She said, handing over affordable medication from the center's pharmacy, stocked through the Basic Health Care Provision Fund. But as Mama Ayo noticed a poster about the Oyo State Health Insurance Agency offering coverage for families like hers, she smiled, feeling a weight lift. The primary healthcare center wasn't perfect. Sometimes there were long waits, and she would hear whispers of staff shortages in other centers. But today, it's not like that. It has not just by her community, but by a system that was finally trying to work for her. To you out there,